everyone, this is Ryan Hoyme, aka Massage Nerd, and today we have Dr. Fabio Di Stefano, right?
Nice to meet you.
Yep, did I pronounce it right?
Yeah.
Yep, okay.
Dr. Di Stefano.
Okay, and so you're at the Canadian Massage Conference today, so what do you do then?
I am a chiropractor, acupuncturist, sports therapist.
Okay.
I'm also an expert consultant for the Vitality Depot.
Okay.
And so this is my first time at the Canadian Massage Conference, and I'm happy to be here. Today I gave a talk on therapeutic modalities. It's an interesting topic because typically massage therapists do not use therapeutic modalities in their practice, so this is a great introduction and a great sort of topic for us to cover so that massage therapists can become more informative or more informed on these modalities.
Yeah, in the United States where I live and stuff, we're not too familiar with what you're doing and stuff like that. So you guys are on the cutting edge, basically, it seems. And
for therapeutic modalities.
Yep. So like with lasers and things like that, because typically for the average massage therapist, it's you have to be underneath the chiropractor, and you usually don't get too much training. That's a problem.
It's a big issue because if used inappropriately can create damage to patients. And on the other hand, if they're used appropriately, they can do wonders. And so we will be offering courses on the separate modalities, which make it clearly straightforward on how to use these modalities. And everything we teach based purely on research. We use the best modalities, whether it be laser, IFC, TENS, EMS, and the research is ongoing.
And what got you hooked on the lasers then?
Clinical experience, response from patients who aren't responding to traditional methods, using different types of modalities. I think in combination with each other work quite well, and now we're just sort of spreading the news to other therapists.
And then, do the clients have any sensations with the laser? Then, do they feel something right then and there, or later on?
Typically with laser, the sensation is typically heat, a thermal effect. And if used inappropriately, if the dosage is too high, then it becomes uncomfortable, which you want to stay away from. So there is a safe range, more towards a comfort setting.
Yeah, so definitely get some training in that area.
Exactly. Training definitely with all these modalities is warranted. I would not suggest anyone just buying these units and utilizing them unless they are training.
And then you're also into like TENS units too, then?
Yes.
Okay.
TENS, EMS, IFC, iontophoresis, and it's great because these modalities can do phenomenal things, but again, proper treatment is required, and each one of these modalities have their own effect.
And where do you see yourself going with all this information then? I mean, do you see yourself teaching a lot of classes in the future, or?
Absolutely. I mean, and this was a great experience, by the way, because it sort of it gave us sort of a taste of how massage therapists would accept, or any of the therapists would accept these new treatment protocols. A great turnout, great response. So where I see myself going forward is attending more conferences, teaching separate classes or lectures on each individual modality, so they get a better grasp on each of these modalities.
And then Vitality Depot was just raving about you left and right and stuff. You got to get them on film and stuff. So
that's great. Well, and I feel the same about them. And the only reason why I hooked on with Vitality Depot is that great reputation. They're on the cutting edge of therapeutic products. They do their research tremendously, with various different companies and manufacturers. So they're making sure that whatever they give you is well within the therapeutic range.
Okay. And you have a practice then in Toronto, is it?
I have a practice. It's called ProMedics, Sports Injury and Wellness Center. I'm the owner as well as clinical director. We offer multidisciplinary treatments, including massage, chiropractic, acupuncture, psychology, medical.
Wow, that's a lot.
We try to cover all sort of grounds, and so whatever we can do to sort of complete treatment for the patient. And these are the modalities that we typically use, and I've found in the last 8 years of practice, using those modalities, the results are profound. And I just feel that if other practitioners were to use these modalities in the proper sort of fashion, the results can be achieved, very similarly to what I'm doing.
Yeah. And compared to chiropractors in the United States, compared to Canada, is there a big difference then, or education-wise, or training, or?
As far as I understand, I think, and I graduated from CMCC, the Canadian Memorial Chiropractic College.
Okay.
Heavily science-based. The education was phenomenal at CMCC. So there are schools that typically lean more towards the evidence-based science approach.
Okay.
From my understanding, the United States have more of the philosophical approach. But again, and
depends what kind of college you go to.
Exactly.
So,
Exactly.
Yep,
it all
yep,
depends. And
yep.
so, but I think in general, there's a little bit of both. But here in Canada, I know it's very evidence-based.
Yep. And acupuncture is kind of built into a lot of courses up in.
Absolutely.
Okay.
And that's another thing how we differ in that it's chiropractors are now encouraged to become acupuncturists.
Okay.
Just to help complement chiropractic and other forms of therapy. And they offer many different courses here, starting from the Acupuncture Council of Ontario to McMaster University. And I found in my practice to be a great combination.
Okay. And where do you see yourself in the next few years? What do you think you'll be doing more then?
I think I'll be teaching more.
Okay.
Love it.
And I sat in some of your classes, just amazed by your knowledge.
Thank you.
Yeah.
It's the passion that I have for teaching and sort of spreading sort of this type of knowledge to other practitioners who really would benefit from treatments that they have no knowledge about, and some of them don't use them because they're just out of fear that they may hurt patients, right? But if that's where I typically will see myself in the next few years is sort of attending more conferences like this and other educational institutions.
Yep. And with a name like Fabio, you can't go wrong. Okay.
You can't.
Yeah.
So a lot easier to get into these conferences.
Yep, exactly.
And classes are typically sold out.
Yep.
Overall great experience, and I won't hesitate doing this again. So.
Yep. And what's the easiest way for people to get a hold of you for more information?
Website.
Okay.
So promedics.ca, and that's www.promedics.ca. Or phone. The clinic is located in Thornhill, 300 John Street, Suite 320. Phone number is 905-882-7688.
And you need to get in the United States soon, too. Okay.
Absolutely.
Information.
And that's the next step.
Yep.
It really is. It's a good trial period. What we're doing now. But I think it'd be quite conducive to what the chiropractors there are doing. Again, it's just with a lot of the new research coming out, these machines are highly substantiated now. So.
Yep. Well, it's been an absolute pleasure.
Likewise.
Yep.
Thank you for having me.
Yep.
Thank you.
Thanks, everyone.
Take care.